thank you all for being here, United for Medical Research. I want to thank you. I want to thank you for saving lives. What you've done has saved lives. I want to thank you for creating economic opportunity. You've done that, created jobs for people in our community. And thank you for providing the support so America could become the world leader. And I just think about how many people come to my state of Maryland every year from around the world. They come to NIH, they come to Johns Hopkins, they come to University of Maryland Medical Center. They come there to get their medical treatment. They come there to get their training. And they come here to be inspired because we have the epicenter for innovation and creativity and research. And we want to make sure that we're able to keep that edge. And that's why I come here first to say thank you for being united for medical research. We need to do an effective job in making the point that President Obama made in his speech, State of the Union address, when he said we have to out-innovate if we're going to be able to out-compete the competition we have around the world. Out-innovate. And NIH is the symbol of innovation and research. Dr. Collins, I want to thank you for your incredible leadership at NIH. We're very proud of the work that's being done there. It's cutting edge on so many different areas that we can just list, that we're making incredible progress. I also want to thank the Obama administration for its budget. Now that may seem strange, this is a freeze. And that's not good news for a lot of programs that need to move forward. But there's an increase in NIH in the president's budget, which I think is more than symbolic. It's symbolic because the president understands that that's an agency that needs to continue to grow. I would like to see it grow by more, and I'm going to give you a way that we can do that. Coming up. But it's also real that it will give additional resources for the very, very important work that's being done at NIH. But I want to talk about the way that I think we can save money in our healthcare system, and NIH now has a new role in doing that, in which I would hope that we would be more efficient in the way that we provide healthcare for Americans. I'm proud to have been part of the Congress that said at long last that access to affordable quality care should be a right, not a privilege in America. And I mention that because 2 days ago I was in the Greater Baden Health Center, just about 7 miles from here, which is a community that does not have enough medical facilities or professional personnel. But they're doing something about it thanks to the help of the federal government. They're expanding their qualified health centers. They're getting people out of the emergency room into preventive care. You see our infant mortality rate in the state of Maryland. Now Maryland's, I think it's the wealthiest state in the country, one of the wealthiest states in the country. Our infant mortality rate number 39 in America. That's unacceptable to me. It should be unacceptable to all of us who live in America. And in the area that I was in yesterday, the African American infant mortality rate is 260% higher than the white infant mortality rates. Health disparities is a real problem in America. It's a real problem. You look at the rate of diabetes among African Americans, twice that than the white population. You look at the amount of Latinos who get prenatal care versus the white population, much less. And the list goes on and on and on. Heart disease, we go right on down the list. There was a study done by Johns Hopkins and the University of Maryland that showed that we are losing about $50 billion a year because of health disparity. My challenge to you all is to figure out a way to solve that, and then we'll give you part of that $50 billion that you can use for medical research. And I think that's a way that we can help try to fill the gap here. We've got to cut down the growth rate of healthcare costs in America. And you're finding the answers to that. You're finding the ways in which we can do that. We're out of step with the rest of the world on the amount of our economy that we spend in healthcare. And quite frankly, our health results indicate why we're so expensive. We're not getting enough preventive care out. We're not dealing with diseases at an earlier stage. There are ways that we can cut down in costs. So, in the Affordable Care Act, an amendment that I authored is now being implemented, which established at the National Institute of Health, the Institute for Minority Health and Health Disparities. Full institute in NIH. And it's going to get the serious attention it deserves. And I'm hopeful that by that institute's work, that we will be able to bring down the unnecessary expenditures in healthcare, which will be a way that we can balance our federal budget so that we don't have to look at a 3% increase in NIH's budget, that we can look at a robust increase because it is so valuable to us in saving lives and building our economy. So I'll conclude where I started. Thank you. You give me hope. I'm really confident that we will achieve these goals. But I look in this room and see people who are devoting their lives to making sure that others can get the benefits of what our innovation will certainly bring. Congratulations.